Hello, my name is Matthew.
Hello, my name is Christian, and we're nurses.
So today we're going to be providing post-mortem care for Mr. Andrew Chen here. And this is Anthony Chen here, correct?
Yes, this is my father, Andrew.
Yeah. Before entering, we would make sure to perform hand hygiene and don the appropriate gear as noted here. And then we would also verify the patient.
With two identifiers, one being the wristband.
And the other being the son. Is this your father?
It sure is.
Andrew Chen? Perfect.
Then we would determine if organs or tissue were to be donated following the organization's practice. We have determined that they will not be.
So the next step is we would tag the patient. So, making sure to fill out the tag with the appropriate information, with the name of the expired patient, mortician, doctor, etc., etc.
And then after doing this, we are going to assess the general condition of the decedent's body. We will note medical devices and tubes and such. We've noted an IV here, and we've also noted a Foley catheter as well.
And then trach as
Yes.
well. So then once that's been done, we would make sure to disconnect and cap all IV lines coming from the patient and to remove all indwelling devices as appropriate for the circumstance. So if the patient had dentures, we would ensure to place them in there securely, and if the dentures did not fit securely, we'd get a little cup to put them in. For this patient here, though, he does have his real teeth, so we would just leave it as is.
Sorry, I'm having a little trouble with this catheter.
As culturally appropriate, if it's deemed appropriate, by the son and the family, we would make sure to place a towel or something underneath the patient's chin to keep it from rolling down. All right. And then we would also make sure there's a small pillow placed behind their head to prop it up. But as you can see, there's already a pillow there, so we would leave it as is, unless the family had a different stated preference.
And then following the organization's practice regarding securing the hands and the feet, we would use circular gauze only when bandaging anything on the body, and position the hands in an elevated position on the abdomen as being demonstrated now.
And they would stay in this scenario.
If culturally appropriate, we can close the patient's eyes by gently pulling the eyelids over the eyes as demonstrated.
Next, we would get a razor and we would shave any facial hair that's noted on the patient, making sure, shaving cream to be gentle and make them presentable.
And then after that, we would wash any soiled body parts. And at this step in the care, we would ask if the family would like to join in washing or partaking in that part. Would you like to partake?
It's okay. You guys can do it.
Okay.
Okay.
And then if there are any soiled dressings noted on the patient, we would replace them with nice clean dressings as well. But it is
There
not.
are no soiled dressings on the patient.
Yep.
Next step would be placing an absorbent pad under the patient's buttocks.
And this is because after someone dies, they can release gas and liquids, so you want something there to absorb it, so it doesn't stay in the bed.
While observing proper body mechanics, we will go ahead and turn the decedent towards me.
Perfect. And following that, we would make sure to remove the soiled gown here and replace it with a nice clean one. And then once we have the gown appropriately attached on, we would make sure to get a comb and to brush the hair for the patient in a nice, presentable way so his hair is nice and organized.
And then after that, after combing, we'd remove any hair clips, hairpins, or rubber bands from
Which
the
he
hair.
did not have.
She did not have. And then after this, we are going to identify which of the patient's belongings were to stay with his or her body, and which were to be given away to the not away, but to the family rather, such as bracelets or necklaces.
And following that, we would want to prepare the body to be presented to a family member if they would want to spend some time with them. Would you like to spend a few minutes with your father?
Yeah, I'll spend a couple minutes with him.
Okay.
A little time goes by.
All right. And then once that would be completed, and we've allowed the family to have time alone with the body, we remove linens and gown per the organization's instructions.
Okay, after this, we will place the patient in the provided shroud.
And then if his body were an infectious risk to other people, we'd make sure that that was marked so people were aware that the body
If you can just turn it towards
is infectious. And then of course we would zip it up and we'd make sure to tag the body as appropriate, making sure to fill out the tag with the appropriate information.
And then after that, we would make sure to get a face sheet for transport and for the patient and have them sent off to the mortuary in a very time-efficient manner. And then we would remove PPE and discard of unused supplies.
Yep. And then once that's been done, we perform hand hygiene. We'd make sure to document the procedure done into the patient's records. And that's all.